how can PRP or cell-based therapies help with bursitis. The way that the cell therapies come into play with regards to bursitis is, so if a patient comes in and have a bursitis and we treat it symptomatically, we do standard treatments, and the bursitis still keeps coming back, and we find an underlying cause, let's say joint osteoarthritis, that's when the cell therapies come into play with the treatment. And that's when they become important. Cell therapies, as you all know, for patients who have been in the clinic, PRP or platelet-rich plasma is the most common cell therapy that we use. And it's a volume of concentrated platelets that we get from your blood, from your venous blood. And it's these platelets that contains thousands of growth factors, which are the ones that are responsible for kicking in and stimulating the healing process. And these platelets are something that we get from your veins about 30 minutes prior to your procedure. You come in earlier, we take out your blood from your veins. We have a lab in the back that processes your platelets, and the platelets are concentrated anywhere from 2-3 times to even 6 times more than your body concentration, which means that you have a super physiologic, super concentrated amount of growth factors that can start the healing process. And we do the injections on the same day. So you're in the clinic for about 30-45 minutes for the whole procedure. If we do the cell-based therapy, which is the other cell therapy that we use, these are different kinds of cells from your body, and they're called the mesenchymal stem cells, which are adult stem cells. And the stem cells are special because they have the ability to not only to renew themselves, but they also have the ability to turn into whatever cells needed by the body. So we get these mesenchymal stem cells from 2 sources in your body, either from your fat or from your bone marrow. So when you have more severe injuries, like more severe arthritis or a large tendon tear, we tend to favor using these cell therapies because they work better for more severe injuries. So that's when they come into play in the treatment of bursitis. It helps treat the underlying cause for these conditions. And with regards to the cell-based therapy, there's a question here: how long to stay in the clinic and what's the process involved? First part of the procedure is we take out the tissue from you. We aspirate the bone marrow from your superficial pelvic bone. And same as the PRP, we process your bone marrow and we concentrate it in our lab. And the concentrated bone marrow has platelets, it's got stem cells in it, it's got other proteins and growth factors that are not in the platelets, that it can lead to a more stronger effect with regards to the healing of your injuries. If we use the fat tissue, we take that from either your hip or from your stomach, or patients call the love handles, and we use what we call a mini lipoaspiration. So much different from the liposuction that most of you are probably aware of or that you watch from YouTube. With the regular liposuction procedure, usually they use a suction machine and they suck out liters and liters of fat from you. For these therapies, we only need less than 50 cc of fat. So unfortunately, it doesn't cosmetically change the appearance of your buttocks or your stomach, which is one of the most common questions that we typically get. But we use a mini lipoaspiration procedure. We use a very, very thin cannula to aspirate your fat. Instead of a suction machine, we use a vacuum syringe to aspirate the fat. That takes probably about 45 minutes because we need to let the numbing medicine sit first in your soft tissue before we aspirate the fat. And then after about 45 minutes, we do the procedure. So you're probably going to be in the clinic for about an hour and a half for the whole procedure if we use the fat-derived cell-based therapy.